Hello, and thank you for taking the time to learn more about the Patient Data Sharing Program and how your registry is working with members of the ClinGen team to increase our understanding of genetics and health. My name is Juliann Savatt, and I'm one of the genetic counselors from the ClinGen team at Geisinger. During this webinar today, we will review the following topics. What is ClinGen? What are the benefits of data sharing? How do you get involved in data sharing? Where is data shared? And what are the risks of participating? Also, we'll let you know who you can contact with any questions or concerns. So first, what is ClinGen? As I mentioned, cureCADASIL is working with members of the ClinGen team to enable data sharing. But what is ClinGen exactly? ClinGen is a project funded by the National Institutes of Health that is working to better understand the relationship between genes and health. Ultimately, the goal is to create a genomic resource for clinicians, researchers, and laboratories to improve patient care. ClinGen has groups of experts that are working to better understand which genes and genetic changes cause disease. All of this work to understand our genome relies on public data sharing of both genetic and health information. ClinGen is working with laboratories, patients, and clinicians to enable data sharing, meaning that ClinGen is working with these groups to make anonymous genetic and health information widely available in public databases. Our ClinGen experts use the information in these databases to learn more about genes and genetic changes. Ultimately, this work will allow ClinGen to create a genomics resource to inform genomic medicine and improve patient care. Healthcare providers, researchers, and genetic testing laboratories will likely use this resource and may also use the publicly available data to inform their work. ClinGen has a number of expert groups representing a number of disease areas, and we are working to understand genetic causes of those conditions. ClinGen is continuing to work to expand conditions of focus and disease areas. In looking at information about ClinGen, you may come across information about Genome Connect. Genome Connect is ClinGen's patient registry for anyone who has had genetic testing who wishes to share their data. It is because of our experience with Genome Connect that we are reaching out to work with other groups, including cureCADASIL. We have recognized how useful patient data sharing is through our efforts and how much patients can contribute. We also recognize that there are many gene and disease-specific groups that are working to collect data. We want to use our experience with Genome Connect and the tools we've developed to work with other interested registries and advocacy groups to help them share data. cureCADASIL has taken the first step and chosen to enable data sharing in the CADASIL Family Registry for individuals and families that are interested in sharing their information. So, what are the benefits of data sharing? First, as I mentioned, healthcare providers, researchers, and ClinGen's experts rely on the collection of data from clinical labs and from patients to guide our efforts to understand genetics and health. To put it simply, the more information we accumulate, the more we will understand. In addition to supporting efforts to better understand genetics, data sharing can also inform genetic testing laboratories' interpretation of genetic changes. When a laboratory finds a genetic change for the first time, they often know little about it. So it might be unclear if that change is related to a health concern or a genetic condition. Data sharing can help clarify these unclear results. If each lab has only seen the change once, it might be unclear to each of them. But if we share between laboratories, clinicians, researchers, and patients, and collectively have seen that genetic change 100 times, we may have enough information to understand that change. Data sharing can help others with the same condition get more definitive genetic test results by reducing the chance for unclear results. Even if a genetic change is well understood, data sharing helps increase our understanding of that condition, including its features over the lifetime, possible interventions, and possible treatments. Data sharing ultimately can increase understanding of a genetic condition and its features. Finally, data sharing also can help make sure patients receive updates if information about their genetic change changes over time. The more information we collect, the better we'll be able to know how genes affect health, and with that understanding, we ultimately will better know how to care for patients. So how can you or your family become involved in data sharing efforts? If you have already registered in the cureCADASIL Family Registry, You can choose to participate by completing the ClinGen Patient Data Sharing Program survey, listed in your incomplete surveys. Choosing Yes on the survey would allow the Patient Data Sharing Program team to access your genetic and health information in your registry account. This small number of team members would then de-identify your information so that it can be shared. Information that could be shared could include your age, gender, race and ethnicity, health history that you provided, genetic test results, and the reason for your testing. If a family member has already enrolled to share their data, you are still more than welcome to sign up. The more information we collect about genetic changes and the health in individuals with those changes, the more we'll understand genetics. Second, to participate, you will need to upload a copy of your genetic test report to your online registry account if you have not already done so. If you no longer have a copy of your report, the ClinGen team can help you request a copy from your healthcare provider or the genetic testing laboratory that performed your testing. Finally, you would have the option to continue your involvement in the patient data sharing program by completing additional optional surveys that your registry may ask you to complete. These help collect additional health information. ClinGen also gives you an option to receive potential updates to your genetic test results if we learn that the genetic change found through your testing may be categorized differently than how it is listed on your report. Genetic testing laboratories try to categorize each change they find into groups based on what information is available about the change. If the lab finds compelling evidence that the change has no significant effect on health, they categorize it as benign. Likewise, if they are able to find significant evidence that the change causes a particular disease, they categorize it as pathogenic. However, this distinction is not always clear. For many genetic changes, there is simply not enough available information to put it into either category. When this happens, the change is categorized as uncertain. A genetic change may be updated over time as new information becomes available. If you choose to receive updates and ClinGen learns there may be a potential update to your results, we will alert you by email and refer you back to your doctor or another healthcare provider in your area to discuss any new potential information. So if you choose to participate, where is information shared? If you choose to participate, ClinGen may share individual information with two types of databases, and there are benefits to having information available in both types. An open access genetic database is publicly available to anyone with internet access and does not require a password. These databases are most often used by professionals involved in patient care that need quick and easy access to the information they are looking for. Controlled access databases are not open to the general public. These types of databases are only available to approved users who request access from an oversight committee to use it for a specific purpose. These databases are most often used by researchers with a specific project already in mind. Because access is controlled, data shared may include more detailed information, such as a complete list of all genetic changes found during genetic testing. The primary database where information is shared is ClinVar, a publicly available database that holds genetic and health information. This open access database is public and freely accessible and relies on laboratories, clinicians, and patients to share their information. Your anonymous health and genetic data would be submitted to this database. Now that we have talked about how to get involved and where data is shared, some may ask, what are the risks of participating? A potential risk is the chance that you could be identified from the information shared and that it could be used to discriminate against you in some way. Your privacy is very important to the ClinGen team, and because of that, we take measures to safeguard your personal information. Identifiable information such as your name, date of birth, and address are never shared. Before data sharing, identifiable information is removed and a unique numerical code is assigned. This code is then securely stored, which greatly reduces risks to your privacy, but does not eliminate them completely. Since many genetic changes are rare, it is possible that you could be one of only a few people in the world or the only person with a particular genetic change. It's important to realize that the more widely you share your genetic and health information, the greater the possibility that you could be identified based on this alone. Keep in mind that simply telling people that you had genetic testing and even telling them the gene in which your change is located is often not enough information to identify you. We believe the risk of being identified through sharing your individual genetic and health information is low, but it is not impossible, particularly if you have directly shared this information with others. If for any reason someone were to identify you, a federal law called the Genetic Information Non-Discrimination Act has been put in place to protect you against discrimination by health insurance companies, group health plans, and most, but not all, employers. Currently, no federal legislation is in place to cover discrimination by life, disability, or long-term insurance carriers. Law in each individual state dedicated to genetic information, privacy, and non-discrimination vary. To learn more about the laws in your state, you can visit clinicalgenome.org/laws. If you are interested in contributing to our understanding of genetics and health, complete the ClinGen patient data sharing survey in your registry profile today. The more information we collect, the better we will be able to understand how genes affect health and ultimately how to best care for patients. If you have any questions or concerns, please contact our team at the email listed, datashare@clinicalgenome.org, or by phone. You also can contact the PIN coordinator at the email listed and can learn more about the program by reviewing the Patient Data Sharing Program survey in your registry account. You also can learn more by going to the ClinGen website at the URL shown. Thank you.